Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NICVD Kings, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. Hamza Gowri, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Assalamu alaikum everyone, I'm Hamza Hussain. It's an honor and privilege for me to welcome you all for the fifth match of Pakistan Cardiac Super League Season 3, which is going to be played between two teams from Group A, Sidhu Teaching Hospital Tigers and BVH Cardinals. Just to update you, from this group, already LNH Pelicans has already qualified for the quarter-final stages, and the winner of today's match will also qualify for the quarter-final stage as well. This event, as always, is a proud collaboration with Pakistan Cardiac Society and is powered by Wilson's Pharmaceuticals. Before we begin, I would like to introduce and welcome the esteemed council members and umpires of today's match. Here with us, the President of Pakistan Cardiac Society, Professor Rajkumar Sir, so welcome. We have also with us the match umpire, Professor Muhammad Saab, and we have also been joined with the mentor of BVH Cardinal, Professor, Associate Professor Dr. Sayyid Numan Ali Saab. So welcome. And last but not the least, I would like to introduce the voice of Pakistan Cardiac Super League, the evergreen, the ever-charming Dr. Hamza Azhar Ghauri Saab, and I would request Dr. Hamza Ghauri Saab to please start the proceeding of today's match. Sir, over to you.
Thank you very much, Hamza. So here we are back again. So I'm going to welcome you all to this third season of Pakistan Cardiac Super League, which is definitely brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. Well, we've already have a couple of very good matches. The last match was outstanding. I think we all witnessed some brilliance from both the teams. And I'm just going to request everyone to please stay quiet, because I think we can hear you and your mics may not be switched off or muted, so we can still hear you. Anyhow, I think we have to get on with the game. And today, again, it's going to be an extremely important game. And as we all know, it is going to be BVH, which is Bahawal Victoria Hospital. And these are the Cardinals, BVH Cardinals, and they're going to go up against Sadhu Government Teaching Hospital Tigers. And it is going to be a wonderful game. And I would request both the teams to concentrate hard, and they have to match up with the standards that have already been set. All right, then, with this, I now move towards the dignitaries. As we know, we have the two umpires, and I think the umpire in chief, he's always there. It's Professor Muhammad Ishaq Saab. Welcome, sir. It's great to have you. We'll be joining in.
Thank you very much, Hamza. Thank you very much.
Thank you very much,
pleasure.
sir. Great to have you, like always. The evergreen Professor Ishaq Saab, and I think we will be joined by Professor Abdul Hamid Siddiqui, and I think we'll have the introduction as he comes in. But it's really great to have the president of Pakistan Cardiac Society, and we have Professor Raj Kumar with us, and I can see him there. Welcome, sir. Great to have you.
Thank you very much, and hope it will be a nice competition. And both the teams
We're all hoping for that.
On fire.
Definitely. Thank you. And we do have the mentor of BVH. It is Associate Professor Dr. Noman Ali. Welcome, sir, and best of luck to you and your team. In fact, both the teams. So, with this, I'm going to move towards the two teams, and I will request the captains of the two teams to introduce their teams. And I think we can start with BVH Cardinals. Captain, start the introductions, please.
Assalamualaikum. Name is Dr. Aftab, final year resident. Here I have Dr. Nizamuddin and here Dr. Matiullah.
All right, so welcome to the show and best of luck. All right, can we have the Tigers on the screen? And can we have the introductions, please? Here we are. Captain, can we have the introductions, please?
Hello. Can you hear me,
yes,
sir?
Yes, we can hear you. Yes, we can hear you.
Good afternoon. I am Dr. Umar, the captain of the GTH Tiger. With me, I have Dr. Inam, the final year resident. Myself, I am also a final year resident. On the left side, I have Dr. Didar and Dr. Sheikh Ahmad with me.
So welcome to this competition. Are you all geared up?
Thank you, sir. Yes.
All right. So best of luck to both the teams. I think with this, we're going to move towards the start of the game. And as we know, it's a bright, shining day. Sun is quite hot right up there. And I think the pitch is looking pretty good as well. And I'm hoping for a good total. So the next stage, as we all know, is going to be the electronic coin toss. So can we have the coin toss on the screen, please? It is going to be done electronically, and I'm going to randomly ask one of the teams. All right, Sadhu, Tigers. Do you want heads or tails?
Heads, sir.
They say it's heads. All right, roll the coin, please. Okay, and it's tails, isn't it? Never mind, Sadhu, you may have lost the toss, but still there is a long way to go, and BVH Cardinals have won the toss. So can I have them on the screen, because I've got two questions for them. Okay, so I'm going to pose you with two questions. The first one is, do you want to throw the questions or you want to take the questions?
Take the questions.
You want to take the questions. All right. Now the second question. Which scenario do you choose? Case A or case B? Either case 1 or case 2?
Case 1.
Okay, so they've chosen case 1.
A 68-year-old man with hypertension and dyslipidemia has symptomatic severe aortic stenosis with peak aortic jet velocity 4.3, mean transvalvular gradient 48 mmHg, aortic wall area 0.8 centimeter square, stroke volume index 38, left ventricular ejection fraction 60%, NT-proBNP is mildly elevated. Society of the Thoracic Surgeons predicted risk of the mortality 2.6%. Computed tomography shows transfemoral transcatheter anatomy is feasible.
All right, so I'll give you a couple of seconds, BVH Cardinals, to get settled, and then we will start with question number 1.
Yes, sir. Good to go.
Okay, so please read question number 1. Tiger,
Question
read the
number-
question with the options.
Question number 1. In aortic stenosis assessment, which parameter is least affected by flow and most reliable to corroborate severe stenosis when Doppler data are borderline? So we have 5 options. Option A, dimension viscosity index less than or equal to 0.25. Option B, projected aortic wall area at normalized flow. Option C, global longitudinal strain. Option D, computed tomography annular area. On option E, left atrial volume index.
And your timer starts now. You've got 60 seconds on your screen. Let's see. So we are on the way now. Seems like a good pacey delivery. Let's see how they negotiate with it.
A.
Option A, alpha. You want me to lock A, alpha?
Yes.
Are you sure about it?
Yes.
Okay, they seem to be pretty sure. Lock A, alpha. And yes, great start. You start off with a 6. That's pretty good. Well done. Okay, question number 2 on your screen. Tigers, to read it, please.
So question number 2 states, for a symptomatic patient younger than 75 years with low surgical risk and suitable anatomy, the default guidelines directed intervention is we have option A, transcatheter aortic wall implantation. Option B, balloon aortic valvuloplasty is destination therapy. Option C, medical therapy with surveillance. Option D, surgical aortic wall replacement. Option E, either transcatheter or surgical aortic wall intervention without preference.
60 seconds are on your screen.
Sir, delta.
Okay, they've come down the wicket trying to play it over extra cover. Are you sure about it?
Yes, sir.
Okay, is this Sahibzada Farhan who's batting? Let's see. So which one? One more. One last time.
Delta option.
Which? Delta. D delta, right?
Yes.
Okay. We are going to lock D delta. And that's a beautiful 6. Well done. Well done. Wonderful. Great going. Okay. Going towards question number 3. On your screen, please.
Question 3 states, which single clinical or anatomical factor least justifies choosing primary transcatheter aortic wall implantation instead of surgical aortic wall replacement in this scenario? Option A, porcelain aorta. Option B, prayer mediastinal radiation. Option C, severe chest wall deformity complicating sternotomy. Option D, patient preference in the absence of countervailing risks. And option E, extreme reality.
The timer starts now. 60 seconds.
Dr. Umar, I would request you to please turn off the speaker of laptop and use micro speakers of your mobile phone. We are getting problem of echo from your side. It's getting echo. You just use your mobile phone speakers.
Yeah, so I think that's nicely pointed out. If you have two mics going on, they will interfere and we will
Delta?
have echo. Okay, BBH. Delta, are you sure about it?
Yes, sir.
You're fond of D deltas, isn't it?
Likely options
Oh.
these are.
Okay, so we are going to lock D delta and let's see what happens. Lock it. And what happens is a 6 again. Very well done. And it's a hat trick of 6s. Wonderful start. Great going. I think we are in for a big score today. Yet again. All right. Question number 4. Tigers, go ahead and read it.
Question number 4. Which measurement most strongly signals very severe aortic stenosis, warranting expedited intervention even when symptoms are equivocal? Option A, peak aortic velocity greater than 5.5. Option B, mean gradient greater than or equal to 60. Option C, aortic wall area index less than 0.4. Option D, stroke volume index greater than or equal to 35. Option E, resting pulmonary artery systolic pressure greater than or equal to 60.
All right, your timer starts now. 60 seconds on your screen. This one seems like another outswinger. Let's see. 3 6s on 3 balls. I would request the team, the BVH team, to keep their mics unmuted. We would like to hear your discussion. Cardinals, unmute yourselves.
Alpha? Sir, alpha?
Are you sure about alpha?
Yes, sir.
Okay, should I lock it?
Yes.
Okay, they say lock A alpha. Lock it. And they are right again. Great answer. Wonderful. Beautiful stroke. Madam is also here. Professor Amber Ashraf, welcome, ma'am. You're here with us, and it's great going yet again.
Thank you. I'm enjoying all the answers of the second team. It's wonderful.
Thank you very much, ma'am. So it's wonderfully done by this team. This is the first innings, and this is question number 4. And we've already had 4 correct answers. And now moving to question number 5.
Question 5 states, during exercise testing of apparently asymptomatic severe aortic stenosis, which specific findings mandates intervention? So in option A, we have systolic blood pressure rise less than 10 mmHg. Option B, ventricular ectopy greater than 10 per hour. Option C, horizontal ST segment depression greater than or equal to 1 mm. Option D, peak oxygen consumption less than 14 ml per kg per minute. And option E, all in systolic blood pressure greater than or equal to 20 mmHg or failure to rise.
All right, you have 60 seconds to answer.
E, sir. Eta option. Eta.
Okay, are you sure about it? E, epsilon or eta? You want
Yes,
me to
sir.
lock it?
Yes, sir.
They seem to be playing pretty smartly. Brisk answers so far. So we're going to lock option E. Lock it. Oh, yes. That's another wonderful answer. Great going. That's too good. No misses so far. They're getting everything correctly. 5 correct answers in a row. 5 more to go. And question number 6 on your screen.
Question number 6 states, to minimize clinically important prosthesis patient mismatch at surgical aortic valve replacement for a small annulus, the most evidence-based strategy is option A, choose a high-profile stented bioprosthesis. Option B, prefer mechanical valve to avoid mismatch. Option C, accept mild mismatch because the ejection fraction is preserved. Option D, use three-dimensional transesophageal echocardiography to upsize the valve. Option E, plain annular/root enlargement are considered sutureless/rapid deployment valve.
60 seconds on the screen, please. Let's see how they negotiate this one. This one is moving quite a bit. It's a leg cutter. Difficult. 25 seconds.
Sir, eta.
Okay. 𝐸. You want me to lock it?
Yes, sir.
Okay, they are saying yes, lock 𝐸. Lock it then. And it's another correct answer. Okay, great guns going on at the moment.
Mashallah.
6 in a row. Mashallah ji, that's wonderful. Wonderful. Great going. Superb. Okay, with this, we move to the next question. Question number 7 on your screen now.
Question number 7. After transcatheter aortic valve implantation in a patient in sinus rhythm without another indication for oral anticoagulation, the optimal antithrombotic regimen is option A, dual antiplatelet therapy for 6 months. Option B, dual antiplatelet therapy for 3 months. Option C, aspirin alone. Option D, clopidogrel alone. Option E, full dose direct oral anticoagulant.
Cardinals, you've got 60 seconds. So it's a flighted delivery. I see some spin on it.
और कोई इंडिकेशन नहीं है जैसे ओटी रिप्लेस है कंफर्म बस कल देखा तो कहीं की
I see smiles all around. They're thinking hard.
Sir, Charlie.
Okay, are you scared to say Charlie or you're confident?
Sir, recent guidelines say so. Previously, it was dual antiplatelet, I think.
Okay, which one? So which one do you want me to lock? C, Charlie?
Charlie, sir.
Okay,
yes.
They want me to lock C, Charlie. Lock it. Outstanding play. Outstanding. Great answer. That's well thought out. They're coming up with the reference to, and I knew the smiles were telling the story, and I'm sure everybody is happy to see this. Great answers. So we've got 7 correct answers so far. What brilliant games we've got. Question number 8 on the screen now.
So question 8 states, which anatomical factor most strongly predicts new persistent left bundle branch block and need for permanent pacemaker after transcatheter aortic valve implantation? In option A, we have coronary height less than 12 mm. Option B, short membranous septum with heavy left ventricular outflow tract or leaflet calcification. Option C, aortic root angulation greater than 60 degrees. Option D, wide sinuses of Valsalva. And option E, ascending aorta diameter greater than 45 mm.
Start the timer, please. So that's a flighted delivery by the leg spinner. We would like to hear your discussion. Yeah. Yeah, this could be a googly. They're trying to ensure that they come in the line. 25 seconds to go.
Short होगा तो उसमें chance ज़्यादा है.
B करें
15 seconds.
Sir, beta option.
B beta. You want me to lock B beta?
Yes, sir.
Okay, so I'm going to lock B beta. And let's see. And superb answer. They were confused between two. I think they were going to go with D, but then they thought about it. And this is great answering. Very well thought out. Good answer. Well done. Indeed. So 8 correct answers. 2 more to go. With this, we have the second last question. Question number 9 on the screen. Come on, Sadhu Tigers. You can also do it.
Question 9 states, which trial first demonstrated superiority of balloon expandable transcatheter aortic wall implantation over surgery for death, stroke, or rehospitalization at 1 year in the low risk patient? So, option A have Sortavi, B Notion, 3C partner is 3, option D evolution, evolute low risk trial, and option E core valve high risk.
And your timer starts now, 60 seconds.
Sir, partner 3.
C.
He's come down the wicket and he
Charlie.
has taken it on the bounce.
Yes.
Ishaq Saab is actually on the edge of the seat. You want to go for a big 6? Is it going over long on? You want me to lock it?
Yes, sir.
C, Charlie. Partner 3. You want me to lock it? And yes! What a great answer.
Great.
Superb. So we do hear some comments. I think even the faculty is excited to see this. Is it going to be 100% score in this game? We are just 1 away from that. 9 correct answers. That's great going. Very well done. So excited to be a part of the show. With this, we come to the last question of the first innings. Question number 10.
Question 10 states, which trial showed that adding clopidogrel to oral anticoagulation after transcatheter aortic wall implantation increases bleeding without ischemic benefit in patients with an indication for oral anticoagulation? So on option A have Galileo, option B Atlantis, option C 𝐒𝐀𝐑𝐃𝐈𝐍𝐀𝐒, option D popular TAVI cohort B, and option E Aurea.
And the timer starts now. 60 seconds.
पॉपुलर ना कर यस सी कर ले सी पता नहीं बात नहीं यार न्यूज़ याद नहीं एक नहीं पढ़ा भी तक थोड़े भूल गया यार बताओ कौन मेंटेनेंस नहीं कौन भी
D. 20 seconds to go. Come on.
D.
16.
Delta.
Sir, Delta.
D delta. You want me to lock D delta?
Yes, sir.
They want me to lock D delta. Lock D delta then. Oh yes. Super. Wonderful.
Mashallah. Mashallah. Super. Maza aaya.
100%. And you have done a wonderful job. I think this is for the first time that we've had 10 on 10 in this season. So great going. Wonderful.
Mashallah, team Bahawalpur. Mashallah.
Noman, Dr. Noman is there. It's great to see him. And he is also excited. Welcome, Noman.
Thank you, sir.
Yes, thank you. बहुत जबरदस्त performance है. Mashallah.
Thank you, sir.
बहुत जबरदस्त. आपकी टीम ने बहुत अच्छा perform किया है. They've done wonderfully well. And I'd like to take the comments starting from Professor Ishaq Saab. Sir, your thoughts?
I just got reconnected, so I want you to give any comment. Let me see the rest of the match.
Okay, sir. So the news is they've scored 10 on 10. The score is 60.
Oh my
No
goodness.
wrong answer.
That's nice.
Yes. That's the BVH team. They've been superb.
So the only thing I can do is congratulate them, you see, and compliment them for an excellent score. So let's see what the other team does.
Very right. And I do see we have Professor Amber Ashraf there. Madam, are you there?
Assalamu alaikum.
Walaikum salam, madam.
आप सब लोग ठीक हैं, खैरियत से हैं? आज तो हमजा भाई आपने मजे करवा दिए. हार्ड वर्क PGs का है, उनके supervisors, team, all that. But really, मैं first part में join नहीं कर सकी. Second मैंने देखा, first का इसलिए I don't know.
मैडम
But
ये
I have
फर्स्ट हाफ
really,
ही है,
really.
हम लेट हो गए, ये फर्स्ट
जी.
हाफ ही चल रहा है अभी, ये पहली इनिंग्स
अच्छा
है.
ये okay, that's wonderful. ठीक है, फिर तो
Yes.
मजा आएगा. फिर
एक
मजा
बार
आएगा.
आप और मैं एक ही कश्ती में हैं, मैं रास्ते में था, इनका तो डिस्कनेक्ट हो गया था काफी
Fine,
देर तक. देयर वाज अ टेक्निकल प्रॉब्लम. सो
fine.
हमारा देखने
Sir,
देखने से फर्क नहीं पड़ता. उन्होंने ऑलरेडी 100%
जी.
स्कोर कर
सर
लिया है.
नहीं, मैंने फर्स्ट क्वेश्चन से ज्वाइन किया है इनको, बट आई थॉट कि मैं 2:30 पे ज्वाइन किया. आई थॉट कि फर्स्ट हाफ गुजर गया है, तो
नहीं
दिस
नहीं,
इज अ
अभी
फर्स्ट टीम. ओह, इट्स
We had some
वंडरफुल.
technical issue in the first 20-25 minutes, so you joined in at the right time.
ओके,
अभी गेम बाकी है, अभी तो पार्टी चलेगी.
ठीक है सर.
बिल्कुल जी.
लेकिन सर मजा आया. रियली सैल्यूट टू ऑल ऑफ यू डियर. कीप इट अप. एंड फॉर द सेकंड टीम, डोंट लूज हार्ट. और आप लोग उनसे ज्यादा अच्छा परफॉर्म कर सकते हैं ताकि हम सब एंजॉय करें और नॉलेज गेन करें.
Thank you.
ज्यादा तो
Thank
नहीं हो
you, ma'am.
सकता.
Sir, अगर बराबर हो गया, then we'll go into the next stage, the knockout
Yes.
stage. We'll have more questions.
Most probably.
So we are actually rooting for that. I do see Professor Abdul-Hamid Siddiqui. Sir,
Ji, thank you very much. Heartiest congratulations to the BVH team, since I belong to Bhavalpur and I have been passing in front of BVH in my FSC days to go to my school. So I'm really happy to see them having maximum marks. And Baka for the Sadhu Tigers. I hope they perform also very well.
very rightly said, sir. I think we have Professor Rajkumar. Sir, what do you
Yes,
think?
it was an excellent work they did, and we hope that other team will also compete nicely, and we wish both the teams the best of luck.
Thank you very much, sir, for your great thoughts and your comments. I think the other team is Sadhu Tigers, so they're going to fight hard. I know one thing for sure, they're fighters. And you know, the way BVH has played, we all want to feel like belonging to Bahawalpur, to be honest. So that's the thing right now. So with this, we now move to the second half, the second innings.
Best of luck.
Sadhu Tigers, are you ready?
Yes, sir, we are ready. I think we already have a very tough competition going on, because they answered all of the 10, sir. So we'll try.
Yes, yes. You see,
We
sir, go ahead.
expect super over.
You are tigers. Behave like a tiger, okay?
We are, sir.
Very right, sir. So we all want them to come up with another 10 not. So that would be 100% score, and then we can go into a super over. Why not? So let's bring case 2 on screen, please. And BVH, read the case scenario, please.
A 79-year-old woman with AFib and CKD, estimated GFR of 35 ml per minute, clinical frailty scale is 6, has aortic valve area of 0.9 centimeter square, mean gradient of 32, peak velocity 3.6 meters per second, stroke volume index is 30 ml per meter square, LVEF is 55%, systolic blood pressure 165/85 during echo, and reduced global longitudinal strain. CT aortic valve calcium score is 1850.
All right, so you have a couple of seconds, Tigers, to gather yourselves, and then we will go ahead. Tigers.
We are ready to go, sir.
Okay, so bring the question number 1. Cardinals, read it, please.
The first optimization to clarify severity in paradoxical low flow, low gradient aortic stenosis with preserved ejection fraction is first, repeat echo after blood pressure control and preload optimization. Beta is low dose dobutamine stress echo. C is exercise echocardiography, focusing on pulmonary pressure rise. D, invasive Golin valve area at catheterization. Eta is CT calcium score alone.
60 seconds are on your screen. Let's see. It's a length delivery. Let's see how they play it. Best of luck to Tigers. And we will request you to unmute yourselves. We want to hear your discussion.
Yes. Eight.
25 seconds to go.
We'll go with the option alpha. Sir. Option A.
You want me to go with option A?
Yes, sir.
Okay. So lock option A, please. That's a great answer. Well done. Well done. So that's the start that we were hoping for. And this is exactly what we have. All right. Can we have the next question on the screen, please?
Which combination most strongly supports true severe AS in this patient? A option is dimensionless velocity index of 0.32 and global longitudinal strain 16%, aortic valve area 0.9 and mean gradient of 32, stroke volume index 30 and EF 55%, LA volume index more than 34, CT calcium score are more than or equal to 1600 in a women and dimensionless velocity index of less than or equal to 0.25.
All right, 60 seconds are on your screen now.
The volume index. I think we should go with the option.
So PC delivery,
Lock
let's see
option
how it
A, sir.
goes. You want me to lock A alpha?
E.
E epsilon.
Yes.
E epsilon. Are you sure about it?
Yes, sir.
Okay, lock E epsilon. Oh, yes. That's another great stroke. And this one was a length one. And you've heaved it, smashed it for a 6 over mid-wicket. Well done. Brilliant answering. What's going on today? It's raining sixes everywhere. Nobody's missing anything.
Super, mashallah, mashallah.
Superb. Absolutely. Question number 3 on your screen, please.
When low-dose dobutamine stress echo is inconclusive, the next step that best adjudicates severity by correcting for flow is calculation of projected aortic valve area at normalized flow, exercise testing with oxygen consumption measurement, magnetic resonance phase contrast outflow track flow, and adenosine vasodilator echocardiography, LA strain reservoir assessment.
All right. Timer starts now. 60 seconds on your screen. You want to hear the discussion? Let's see. Tigers.
This is a bit tough, though.
Yes. This one is definitely moving a bit off the wicket and in the air. We can't hear you. Tigers, please unmute. Approaching 25 seconds. We can't hear you. 20 seconds. Okay, hold on. We can't hear them. Hold on.
A.
A.
Okay. A alpha. You want me to lock A alpha?
Yes, sir.
Okay, lock A alpha. Oh, superb. Nothing seems to be bothering them. They are all going great guns. Ishaq Saab thought for a moment that you will probably find it difficult, but wonderfully done. Greatly
Very good.
negotiated.
It was a bit tough one.
But sir, even then they got it right. So kudos to all of them and
Hats
their
off.
preparation. Well done.
Hats off to them.
Very right. Now, question number 4 on your screen.
Which measurement error most commonly explains discordant grading in low flow, low gradient AS? Underestimation of outflow track velocity time integral, overestimation of continuous wave Doppler velocity through the valve, aliasing in pulsed wave outflow track velocity, overestimation of outflow track diameter used in the continuity equation, planimetry error on transthoracic echo.
Timer starts now. You've got 60 seconds. Already 3 correct answers. They're chasing a monumentous total of 60. Let's see what happens.
We'll go with option D, delta.
Okay, they seem to be pretty confident. They want to go with D delta. Are you sure? Okay, he says yes.
Yes, sir.
I like the confidence. Lock D delta. And the confidence is paying them.
Wow.
Yes.
What a fight. What a fight.
What a fight, sir. They are chasing it like anything. Oh, okay, BVH. Cardinals. It may not be over yet. Let's see. Great game, great going. Bring question number 5 on the screen, please.
In AFib with CKD, undergoing transcatheter aortic valve implantation, the preferred postoperative antithrombotic approach is oral anticoagulation plus clopidogrel for 3 months, oral anticoagulation plus aspirin for 3 months, oral anticoagulation alone, dual antiplatelet therapy alone, aspirin alone.
The timer starts now, 60 seconds. Bouncer, let's see. It's going to be an uppercut, a hook, or a pull. Let's see.
We'll go with Charlie, C.
Okay, you want me to lock C Charlie. Okay, lock C Charlie then. Oh yes! Once again, another correct answer.
Great.
So 5 in a row takes us to a score of 30. You've answered half of the correct answers correctly. Half of the questions have been correctly answered. Now you've only got 5 more to go. You think you can do it? Yes. They seem to be confident. I can hear you even without a mic. Well done.
They have no choice, Hamza.
But they are chasing it like anything. I just hope Pakistan team, they take some heat from this and they also start chasing. And we're all hoping for that. Anyhow.
Yes, sir. Inshallah.
Inshallah. That's the spirit. Question number 6. Bring it on the screen.
For women, CT aortic valve calcium score most consistent with severe AS is more than 1200, more than 1600, more than 2000. Thresholds are not sex specific. Calcium scoring is unreliable in low flow states.
And the timer starts now, 60 seconds, as we can see on the screen. Unmute, please. Yes.
Well, that seems a little quite easy. We'll go with Alpha Charlie.
You want to go with
Alpha, sorry, Charlie, no Charlie. Alpha A.
Okay, you want to go with A Alpha. Alpha Charlie was a bit
Yes.
confusing. I thought Alpha Bravo Charlie, but then that includes
Yes,
everything.
I thought the same.
Okay, you want me to lock which one? Charlie or Alpha?
Alpha. A.
A Alpha. All right, lock A Alpha. Oh, goodness. That's the first blemish, first mistake. Oh, goodness. You know,
1200.
this was definitely a turning delivery. Turned the other way, you went the other way. But never mind, you guys are doing a wonderful job. But we now know the outcome. You've missed the question. You had no option, in fact. You had to answer all of them correctly.
Keep it up.
Keep it up. That's the spirit. Madam says, keep it up, and you should be proud of yourselves. So, we're going to move ahead with question number 7. Question number 7 on the screen, please.
Frailty.
Can you go to the question number 6 again? Just
Okay,
for
they
the
want to
sake
go
of
back to the question number 6. You have
just
any
for
question?
the sake of knowledge, sir.
Okay, but go back to question number 6.
Can we, sir? Can we check this? I think this is for females. This is greater than 1200 per male. This is greater than 2000.
Okay, we do have the umpires on board. We do have the umpires on board for such situations. And we have Professor Ishaq Saab, who's there. We also have Professor 𝐓𝐈𝐆𝐄𝐑𝐃𝐈𝐍𝐀𝐃𝐈𝐶 Siddiqui. Sir, you want to take this?
I think these answers are supported by references, you see. So there may be more than one correct answer, but the best answer is which is chosen by the reviewer and setter of the scenario. So one question can have more than one answer, but we have to choose the best answer.
Yes.
I think I'll agree with Professor Ishaq. As far as I can recollect, it's more than 1500 for women and more than 2000 for male. So 1200 is, I think, as suggested by Professor Ishaq, according to the key, there seems to be a B for correct answer.
If they have any objection, I think we can produce the references and satisfy them. But they should have trust on paper setters and scenario setters, because there's no bias, you see. It's just a...
I want the references, sir, because the new guidelines suggest this is greater than 1200, sir.
We can record your protest or complaint or your point
As
of
far
view,
as
and
me and my team
person
remembers,
who has
for women it is greater than 1200, for men it is greater than 2000.
Hamza, I
Okay,
suggest...
so I'd like to take it from here, sir. I think Tigers, there is a system behind this whole process. So all these questions, they go through rigorous assessment, and you see, we definitely have a key, and it's referenced by the data and the guidelines. So you can, we have now registered this. This is going to go into review, and they're going to get back to you with all the answers and the references that they've got. All right.
Their viewpoints will be recorded and registered.
Yes. Yes. So I think with this we move on.
Sir,
because
as
the
far
idea
as
is to... Okay, Tigers,
it
hold on.
is just for the knowledge sake of knowledge, sir.
Okay, we understand.
Right.
I know the
question
spirit.
states, sir, the question states for women with a computed tomography aortic wall calcium score most consisted with severe aortic stenosis. So it is not highly severe aortic stenosis. Highly severe aortic stenosis we have greater than 1600.
Okay, so Shadow Tigers, hold on. We'll have to stop here. I think we have registered the point.
My dear friend,
registered the point.
we cannot make a decision here because it can't be a single man decision. It has to go to the reviewer. It has to go to the person who has set the questions, and we have to look into the references and satisfy you. If we
And
fail
Sadhu
to identify
Tigers.
you, we'll take your point of view.
Yes, yes, Sadhu Tigers. You know what? What
Dear,
happens is
dear
there is a
Tigers,
right, ma'am.
dear Tigers, what I suggest, आप लोग अगला question लें और game को complete करें. There is a process behind. They'll check और कोई भी आपके साथ ज़्यादती नहीं होने देगा. Don't worry. अगले question पे
Ma'am.
focus करें और game को carry on
Okay,
करें.
ma'am, I just want one request to please review this question
Sure.
6. That is not
Sure.
high severe, highly severe. It is only
I got
with
your
severe.
point, dear. I got your point.
My dear boy,
The
we have
team is
already
going to
registered
review.
your complaint.
Thank you.
Okay, Sadhu. Sadhu Tigers, I want you to look into the screen and look at me here. You see, this season, this is the third season. We have had many matches. And we've always gone into the reviews. The review committee sits, they review it. If this is the correct answer that you are saying, you're mentioning, I'm telling you, you have my word and the faculty's word. You'll get the marks for this. So, make no mistake about it.
Okay,
the whole
sir.
system
Thank
is
you.
there.
Just review
All right?
this question.
Okay, don't worry. But
अगले
you need to
question पे
focus.
focus हो जाओ, इसे भूल जाओ.
Yes, yes. And you still have got 3 more questions to go, and you've got to, in fact, 4 more questions. So you have to focus on that. All
Okay.
right, with this, we
Okay,
move
sir.
to question number 7. Bring it on.
Frailty should most directly influence which hearting consideration? Lower expected procedural stroke risk, selection of surgical aortic valve replacement instead of transcatheter therapy, reweighting net clinical benefit and life expectancy, possibly towards palliation, mandatory balloon aortic valvuloplasty, contraindication to any intervention.
60 seconds have started. And let's see how it goes.
Stroke risk होना चाहिए. Selection of surgical aortic valve damage, prevention, clinical benefit, life extension, mandatory balloon I think we should go. Option C, sir.
Okay, so you want me to lock option C, Charlie.
Yes, sir.
Should I lock it? Okay, lock C, Charlie. And that's the right answer. Well done. So you're back on track and doing a good job. Keep your focus. Okay, we still have 3 more to go. Question number 8 on your screen.
In paradoxical low flow, low gradient AS with preserved EF, which echocardiographic marker best reflects subclinical LV systolic dysfunction and worse prognosis? E/E prime ratio, reduced global longitudinal strain, tricuspid annular plane systolic excursion, LA reservoir strain of more than 45%, RV systolic pressure of less than 35.
The timer is on your screen now. 60 seconds.
Left atrial reservoir
We'll go with option B, beta.
B beta. You want me to lock B beta? Okay. Lock B beta. And definitely the right answer. Very well played. Great going. I think you guys are answering pretty well, discussing it, looking into it deeply, and that is the spirit of the game. Well done. 2 more to go. Second last question of this innings, question number 9.
Which trial showed non-inferiority of self-expanding transcatheter aortic valve implantation versus surgery for death or disabling stroke at 2 years in intermediate risk patients? Certavi, partner 2A, partner 4, Notion, core valve high risk.
The timer starts now. 60 seconds are on the screen. It's a flighted delivery. The spinner is on.
Notion the core one done. Partner for the same thing. And then we'll go with option A, alpha.
Are you sure about it? A alpha, you want me to lock it? I'm going to lock A alpha. He's saying thumbs up. Lock A alpha. And yes, it is the right answer. And brilliant answering. Superb. I think this is brilliant work by the team. They thought about it and they were deciphering it in a balloon expandable and all those things going into play, intermediate risk, and brilliantly done. Great work. So they had to rule out the balloon expandables and then the self-expandables, and they were focused onto it, coming up with the right answer. Good job. So with this, we move to the last question of the second innings. Question number 10. Bring it on.
Which trial in low-risk patients with a self-expanding valve demonstrated non-inferiority of transcatheter aortic valve implantation to surgery for death or disabling stroke at 2 years? Notion, partner 3, 𝐂𝐀𝐑𝐃𝐈𝐍𝐀𝐃𝐈, evolute low-risk, expand TAVI.
And the timer starts now, 60 seconds.
Notion partner 𝐂𝐀𝐑𝐃𝐈𝐍𝐀𝐃𝐈 Dr. Tevi No. I think you should go with the D. Evaluate low-risk. We'll go with option delta, D.
How sure are you about it, D delta?
Yes, sir.
You're sure about it?
Yes.
The captain says, I'm sure, lock it. All right, let's lock it. And he is rightly sure. Very well done. Superb answer once again. So that's great going. And with this, we come to the end of this match today. And we know where we are. We know that it was a brilliant performance by both the teams. BVH Cardinals, they went first. 10 questions, 10 out of 10, a score of 60. And Sedu Tigers, they came up with 9 correct answers with a score of 54. We know that one question is going to go into the review, but you know the team is there. They will review it. They will get back to you. So don't you worry about it. And then there's a whole system.
The question stem, sir. Please carefully read the question stem.
Don't worry. The review committee is there.
We
yes,
cannot
sir, please.
make a decision here. It has been registered, recorded, and it's quite possible that there may be change after review. I think you are very close to victory, and you have done very well. Just, I mean, as much.
Sir, I think it's not going to be victory. It's not going to be victory because I think then we'll have to put them back again.
Yeah.
For a super over.
So, please carefully read the question. I am very confident about it. This is not somebody start congratulating them, but this is not the end yet. Please read the question again. That is question number 6.
Don't worry.
There is a difference between severe and very high severe. Please.
Okay. Don't you worry about it. Tigers, you have to behave like tigers also. So it's not the end of the world. It's not the end of the world, and the whole team is there. I want to reiterate. We have umpires, we have a review committee. This has happened in the past, and nobody is going to snatch anything away from you. You will get what you deserve, and I think the team is already on it. So I would say congratulations to both the teams. Abdul Hamid Siddiqui Saab, I can see you. Your thoughts, please. He's the other umpire.
Yes, I think full marks to these Sedu Tigers with a comprehensive preparation of the subject and, reciprocating to the BVH Cardinals in the same way. I'm very happy to see them to answer that.
Thank you very much, sir. It was a brilliant performance. Ma'am, are you still there? Professor Amber Ashraf. So I do
Ji
not
Hamza,
see. Yes,
Assalamu
madam.
alaikum.
Walaikum
Ah,
assalam.
it's really a wonderful match. All of us enjoyed. Salute to 6 of them and their supervisors and what they are saying. Before, congratulations to both the teams. What is important, the Sedu team, don't worry, just relax. What you are saying seems to be something in the guideline list, but there is a full panel. They are going to review your question and things. And all of us are human beings. If there is some mistake or something in the key, they are going to rectify it. Don't worry. But congratulations. And if the result is the same, 10 and 9 still, that is a wonderful match. All of us enjoyed it. And we wish all the PGs to have this good grip on the knowledge, and then they'll be able to perform and improve their skills. And the attitude component as a cardiologist is a very important part of our training. Because whenever you deal with your patients or any scenario which come across during your practical life, there we must have a balanced attitude. We must have to register our whatever the complaint or whatever the suggestion, but just trust. Nobody is here to hurt any one of you. Okay? Congratulations. I have really enjoyed it. And salute to all of you, and thanks to Wilson Forma and Hamza bhai, you are doing great. और आज जो है प्रोफेसर इसाक साहब की बातें हमें जरा ब्रेक हो के सुनाई दे रही हैं, शायद सर ट्रैवल कर रहे हैं या नेट
नहीं मैं अभी मैं आई एम बैक इन माय रूम।
मैम सर आ रहे हैं मैदान में
आप
अभी।
बेहतर हो
अभी
गया
देखिए
सर, आपकी
बात
मजे
ये
की
है,
बातें ना सुने तो हमें मजा नहीं आता
अच्छा
है।
नहीं आप सुने, मुझे मजा आ रहा है। बात ये है कि इतना हाई स्कोर जो है ना, ये क्यों हुआ है? कभी आपने सोचा है? दिस इज द आउटकम ऑफ दीज टूर्नामेंट्स, दीज मैचेस दैट वी हैव बीन होल्डिंग इट। पहले शुरू में किसी के 5 ठीक होते थे, किसी के 3 ठीक होते थे, किसी के 4 ठीक होते थे। Nobody was going to that high score, you see. So this is the last few matches that we have seen. People are scoring 10 out of 10, 9 out of 10, 8 out of 10. And this is the result of this tournament, you see, because this tournament has proven to be a stimulus to our fellows to read the guidelines, read the latest updates. And I think both the teams have done marvelous. And Sedu should not get impatient. Their observation has been recorded, registered. And because we have a system in place, I can't make a decision on my own. Hamza can't make a decision on his own. Let it go to the review committee, and we'll have we'll come back to you. If you scored the same, then I think we have to go again for another test. You see.
Yes, sir. We'll have a super over between them, and we'll get the winner out of them.
Actually, the way you are fighting, we thought we'll have an even number, and then we'll go for a extra time. वो जो पहले फुटबॉल में होता था, एक्स्ट्रा टाइम दिया जाता था, तो वो एक्स्ट्रा टाइम
सडन डेथ होती थी सर।
तैयार थे, मैं भी और हमजा भी, लेकिन वो बस आपसे गलती हो गई, और उसमें हम भी डिसअपॉइंटेड हुए कि आप इतना अच्छा कर रहे थे और आपने एक गलती हो गई। तो नेवर माइंड, 9 out of 10 is not a small score by any means. So thank you very much, everybody. And
thank you.
I think last week we were in Lahore, and Sedu won the cardiometabolic thing. You are hosting there as well. So I think
sir, it was actually the two teams, the same teams were there. It was BVH versus Sedu.
Yeah, that's right.
और सर अब इसीलिए इनका ईगो का मसला बन रहा होगा।
It's a great coincidence, but I think कभी-कभी ऐसा होता है कि दोनों टीमों को ट्रॉफी दी जाती है ताकि दोनों खुश हो जाए।
I think
Bilkul
both
sahi,
teams
sir.
deserve, sir.
So both the teams have done fantastically well, and I think, Madam Amber Ashraf, your points were spot on, and same is with Professor Ishaq. He's always there with his comments, and he's guiding everyone. So I think he's absolutely right there. This is going to go into the review committee. This is beyond our scope at the moment, but we will do whatever is right, and justice will be done. And make no mistake about it. Be very clear on that. And at the end of the day, it's all about learning.
Let me explain to them in a clinical language. Whenever you have got a patient who has got some clinical findings, some investigation findings, you always have more than one option to treat him, you see. And then you choose the best option. This is the best option after discussing with the patient, keeping in view the comorbidities and the rest of it. Then you make a decision that, okay, ये भी कर सकते हैं, मगर ये ज़्यादा बेहतर होगा आपके लिए. तो ये इस तरह की सजेशन होती है बाद में.
Only one request, sir. Only one request. Sir, the recent guidelines suggest that there is a difference between severe and very high severe.
My dear, we are not refuting you. We are not refuting you. We are not saying that you are not right. Okay?
So you see, the two teams have to understand that this is just, these questions, they are there. One aspect is to answer the question. This is part of the game, but it's not the end of the world. You see, we are all learning every day, and the idea is to impart knowledge and learn. We are all learning with this. But at the same time, it is as ma'am has mentioned, the attitude and the way we carry ourselves. That's also equally important. Always remember that. And whenever there is some issue, some conflict, there are ways of resolving it. So there is a system, there's a mechanism in place. So don't you worry on that account. You've been brilliant. We are already acknowledging that, and we'll be on it. And having said that, I think we do have Professor Rajkumar Saab. Is he there?
Yes, thank you very much. I think I must congratulate both the teams and also you as well. Conduct in a way, and this is a healthy competition. No one should take it personally. And I will congratulate all the Pakistan Cardiac Society and all of this program. This is just that now everybody is well up to the mark and they are trying their best. So thank you very much. I'm Amber Ashraf for encouragement of both the teams and all the other teams. Hope it will go on into the finals. The best team will naturally get a good prize. Thank you very much, Hamza.
Thank you very much, sir. So as Professor Saab has mentioned, the scores are improving, and this competition has become a catalyst. Now the teams are coming more prepared, and they are coming up with the goods, and the scores are going high up. I do see my friend, I think it's Dr. Noman Ali. Your thoughts, Noman? It was a great match.
थैंक यू हमजा. बहुत बहुत शुक्रिया प्रोफेसर इसाक साहब का, मैडम अंबर और प्रोफेसर राजकुमार साहब का. वो सब मौजूद थे और बहुत ही अच्छा, बहुत ही हेल्दी कंपटीशन था. दोनों टीमों को बहुत मुबारक हो. जो सबसे अच्छी बात थी कि हमारे जो पीजीआर्स हैं उनका लेवल ऑफ अंडरस्टैंडिंग कॉम्प्लेक्स सिनेरियोज का, कॉम्प्लेक्स क्लिनिकल और एकोकार्डियोग्राफिक जो थी अंडरस्टैंडिंग, वो बहुत अच्छी थी. तो बहुत मज़ा आया और बहुत ही अच्छा लगा उनके लेवल ऑफ अंडरस्टैंडिंग और कॉम्प्रीहेंशन का इन डिफिकल्ट सिनेरियो. तो बहुत ही अच्छा और बहुत ही टफ कंपटीशन था और सब लोग जो हैं वो बहुत अच्छा पीजीआर ने बहुत अच्छा परफॉर्म किया. तो आई कांग्रेचुलेट बोथ द टीम्स एंड ऑल द पाकिस्तान कार्डियक सोसाइटी एज वेल. थैंक यू.
Thank you very much,
Okay,
Noman. So
my regards to
Yes,
all
sir.
the colleagues, and I'll take your permission to have a little nap.
Thank you very much, sir. It was a pleasure having you. And with this, we come to the end. So I'm going to congratulate both the teams. I think they were absolutely brilliant. It was neck and neck throughout. I know this one question has gone into the review, and the review board is definitely going to come back to us, and we will have the final word. And I can assure both the teams that we will do the best thing possible. We know that the guidelines at times can be contradictory as well. So I think they'll definitely come up with the right reference, the right comparison, and the right outcome. But today, everyone is a winner. Everyone is a winner, and everyone has done brilliantly well. Yes. So I think
only one request.
Who is this? Who is this?
Our coach and the review committee.
Okay, don't worry. There is a system, as I've mentioned. There is a system. Tigers, there is a system. I think the review board will get back to you with all the evidences, and if there is a correction that is made, then we will definitely have the super over. I am telling you, I want to have you back. This is my personal desire as well, but we have to follow the rules. So with this, I think in the interest of time, we will beg leave from all of you, and I think it was wonderful to have all of you.
Congratulations to both the
Congratulations. Congratulations. And so that's it from here. I think we're going to move ahead. And till next time, it is Allah Hafiz from my end. Best of luck to you all. See you next time.
Thanks a lot. Allah Hafiz.
Allah Hafiz.
Take care.